Hi everybody, my name is Jacob, and I'll be presenting on Chapter 6, Musculoskeletal, Neurological, and Neuromuscular Impairments. This is a pretty dense chapter with a lot of different impairments listed, so I'm going to try and kind of give a broad introduction with a little bit more specifics on a few of the more common disabilities that we discuss in the chapter. So, to start it out, I'm going to give a definition of each of the types of disabilities that we discuss in this section. The first is musculoskeletal, so it affects the bones, joints, and muscles, basically the muscular and skeletal system of the body. Neurological, it affects the nervous system. Neuromuscular is an impairment affecting both. So to start it out, let's talk about a few of the musculoskeletal disabilities. So there's a pretty broad range of musculoskeletal disabilities listed in the chapter. I've got all of them that we read about in the chapter here, but I was gonna go into a little bit more detail for muscular dystrophy, arthritis, and spina bifida. So to start it out, muscular dystrophy is just a group of related muscles that progressively weaken and then cause atrophy of the voluntary muscle groups surrounding them. So in the chapter we read about three different types. I believe it's pronounced Duchenne, limb girdle, and then facioscapulohumeral. So the first one is most common in children. And in this nifty little picture here, it kind of shows the affected muscle groups. And so children usually start to show symptoms around 2, and then the areas in red just start to weaken. And so there's some slouching, some difficulty walking. And as far as one for children, there's really no treatment known. The next one listed in the book is facioscapulohumeral, and this one is characterized by face drooping and weakness in the shoulders and arms, and also in the hips and legs. So that's where the facioscapulohumeral comes in. And limb girdle is basically the same as the previous one, just without the face drooping. And these two are usually found in adolescence, and people usually live fairly normal lives with this. So the next one that I was going to talk about is spina bifida. So this is actually a pretty common one. There's 3 different types, I guess, of spina bifida: occulta, meningeocele, and myelomeningeocele. So occulta is the least serious. There's not very many symptoms occurring with it, but basically in any one of these 3, the vertebral arches fail to form around the spinal cord, and it can either cause as little damage as just a hair patch, or which is spina bifida occulta, or in myelomeningeocele, the spinal cord actually protrudes out where that deformation in the vertebral arches occurs, and it can pinch off the connection, or the nerves can simply fail to innervate the lower regions below that lesion in the spine. And so defects can range from, again, that small patch of hair to numbness and tingling, or to complete paralysis with no sensation and bowel incontinence as well. And hydrocephalus is also associated with myelomeningeocele, and so a shunt is oftentimes placed from the brain down into the abdominal cavity. The next one on the list for musculoskeletal disabilities is arthritis. This is fairly common. A lot of people know about it, and a lot of people experience it as well. So basically, there's 2 different types. There's rheumatoid arthritis, which is just a breakdown of cartilage in between the joints, and so the bones sort of pound and scrape against each other, and it can cause a lot of pain, swelling, and deformation also. And it happens a lot for elderly people, and many of you have probably seen hands that are shaped like this because of arthritis that has occurred in the past. So those are the three most common musculoskeletal impairments that we've seen. And so I'll move on to the neurological disabilities examples. So there was a lot less in this section that were listed as neurological disabilities, but there was cerebral palsy, seizure, convulsive disorders, epilepsy, cerebrovascular accidents or strokes, and multiple sclerosis. So to start out, I'm going to talk about cerebral palsy. Sorry, I have a paper. So cerebral palsy is basically caused by deformation in the brain or a lack of development in a certain portion of the brain, or it can even be caused by brain trauma after birth. But there's a lot of different things associated with cerebral palsy, such as visual impairments, seizures, tremors, emotional lability, distractibility, hyperactibility, poor reflex activity, low motor coordination, scoliosis, bowel incontinence. There's a lot of different things that can affect these people, and it usually manifests itself at a fairly young age. So it's just underdevelopment or lack of development in a certain region of the brain that manifests itself usually physically and also mentally. There is a lower life expectancy, and the physical and mental manifestations of it can be pretty drastic. The next one on the list is strokes. This is pretty common, especially in older people, and there's two different types of strokes. There's hemorrhagic and ischemic. That just means hemorrhagic is a hemorrhage in a blood vessel in the brain, and ischemic is a blockage. So a stroke is just when blood flow is cut off from a certain portion of the brain. So whether it's through that hemorrhage or through a blockage because of fatty tissue buildup or a blood clot, just a portion of the brain is cut off from its blood supply, and so it doesn't get the blood flow that it needs to function. The next one on the list, actually let me just touch on that a little bit more. Once that blood flow ceases to happen, it basically disables that portion of the brain. So depending on where it is, frontal cortex, occipital lobe, parietal lobes, you can lose function for that portion of the brain. So occipital lobe, you'd lose vision and that sort of thing. Frontal lobe, maybe decision making, lack of recognition, that kind of thing. So it basically just disables that portion of the brain because of lack of oxygen. The next one on the list is multiple sclerosis. And this, as you can see from the picture, is a damaging of the myelin sheath surrounding a neuron. So many of the major motor neurons in our body are surrounded by this myelin sheath that helps with the electrical conductivity of the neuron based off ion flow. And so without that myelin sheath, the transmission of the electrical impulse is unable to make it to the other end of the neuron to conduct the desired action or to transmit the information back to the brain. And so this is a progressive disorder that usually shows up in individuals later in life, and it can be really debilitating at first. It shows up pretty slow, but then as it progresses, more of that myelin is, I guess, degraded off of that neuron, and eventually those neural impulses can fail to reach the other end of the neuron, and it can just be lost. This can result in even paralysis, lack of sensation, and a number of different things, but those neural impulses just don't reach the other end. So this leads us into neuromuscular impairments, The two that I'm going to touch on are spinal cord injuries and traumatic brain injuries, but there are a few others such as Huntington's chorea, Parkinson's disease, ALS, Lou Gehrig's disease, or Guillain-Barré syndrome and Friedreich's ataxia. So again, these are just impairments that affect both the neurological side of things as well as the muscular. So spinal cord injuries are something that a lot of us have heard about, and I thought this picture was pretty good because it shows what portions of the spinal cord, based on their relation to the spine, innervate which portions of the body. So the cervical portion is going to innervate from the abdominal region all the way up to the head, and the thoracic is going to innervate the abdomen as well as lumbar, doing the legs, the sacral region, the feet. So any sort of trauma that is going to create a lesion in the spinal cord, people are basically going to lose sensation and the ability to move below that point. So, for example, if we took a lesion in the cervical area, then everything below, for example, if it was at C1, everything that's pink and below is going to be paralyzed, and there's going to be a lack of sensation depending on what part of the spinal cord is damaged. So this goes, if it was lumbar L1, it would be lack of sensation and paralysis below the hips. And so any sort of damage or trauma to the spinal cord acquired after birth is going to be categorized as a spinal cord injury, and it's going to come with those symptoms. Traumatic brain injury, this can be from a concussion. The book gave the example of a gunshot wound. There were two different types. There's the open, which would be the gunshot wound, or there would be closed, which could come from a car accident with a concussion. But the traumatic brain injury damages that soft tissue of the brain, and it renders part of it incapable of functioning. So again, if there was damage in the frontal cortex, then you'd have issues with decision making or decisive thinking, facial recognition, that kind of thing. So it really depends on where that brain injury occurs, but there can be some major emotional and also physical defects depending on where it is and what part of the brain. And so now that we've kind of blown through examples of those musculoskeletals, neurological and neuromuscular disabilities, there's a lot of them, but what is the purpose of therapeutic recreation? So even though there's a huge variety of impairments and things that can happen either prenatal or during the course of our lives, the purpose of therapeutic rec is just to help people learn or to relearn. These are huge changes or factors in people's lives, and the goal of therapeutic rec is just to help people not only learn how to cope with the challenges that they experience, but to help them learn and progress beyond what they imagined, whether it's learning how to use a wheelchair or learning how to relieve the muscle tension that comes from cerebral palsy, or learning how to improve mobility after a spinal cord injury. The purpose of therapeutic recreation is to help these individuals get back the quality of their lives that they may have lost, or maybe just improve the quality of their life through recreation, sports, outdoors, and it's an awesome thing to be able to do. So thanks for watching. Hope you learned a little bit about some of those impairments and are able to think about the purpose of therapeutic recreation.